the first question is, what is histopathology? So from experience, who can try out, who can give us an idea of what histopathology is? Raise up your hand. I want to know what's in Adesua. Adesua, no matter how crude, whatever you want to say, let me know what you want to, or what do you understand when we define, or let me just unmute everybody so we can, yeah, who has an idea? Raise up your hand if you can give me a basic explanation of what histopathology is. Anybody at this time?
Sir, can you hear me?
Oh, yes, I can hear you.
Okay, from my knowledge, histopathology is like the study of the changes in tissues, rather.
Yeah, that's a nice attempt. Who else? Let's call on Nene. Nene, are you with us?
So, yes, sir. Like she said, changes in tissue, but it's mostly tissues that have been altered due to diseases. So that's where the pathology comes in, I guess.
Okay, what of Oluwanifemi? Do you have anything new to add to what they've been explaining?
Sir, what I think it is, I think it's a study of diseased cell and tissues.
Okay. Yeah, thanks for that brilliant attempt. So, anytime I'm trying to, this first thing that if you want to explain, if you want to describe something, is what are the basics? So now, look at the screen again, and so this, if you, in the dictionary, when you type histopathology, these are the pronunciations.
Histopathology. Histopathology.
So this word, I can deconstruct it into 3 components. So we have histo, and we have patho, and we have logy. So logy talks about study. Histo talks about tissues, and patho talks about diseases. So histopathology is the study, the basic explanation is the study of changes in tissues that are caused by disease. So there is a whole lot of difference. At this level, you should know that when you want to define something as in health and disease, when you are referring, when the term pathology is there, it's no longer in health, it's already in disease state. So there is a difference between, okay, everybody look up what is histology. Now look at this. There is a difference between pathology, histopathology, and histology. And because in histology, you can see histo is still there, logy is still there, but patho is missing. So what we are talking about here is a study of tissues. But we cannot be talking about tissues in isolation. We cannot be talking about tissues abstractly. So which is why we are pulling up our microscopy. So the study of the microscopic structure of tissue is histology. Now there is a difference. Look at it. We have histology and we have histopathology. So from this definition of histology, this is how you pronounce it.
Histology. Histology.
So from this understanding of histology, you can understand that histology is like the umbrella, and pathology is an aspect of histology. So which means when we are studying, in histology, we are focused on tissues, whether they are in good health or whether in disease condition. And when the cells, tissues are in disease conditions, that is when we talk about histopathology. How that is clear. So histology is the study of microscopic structures of tissues, while histopathology is the study of changes in tissues that are attributable to diseases. And well, you can There are diseases in medical laboratory science. Uh, diseases are seen in many lights. Uh, diseases are seen in various. They are seen in various perspectives, and the kinds of diseases that an individual has would. Your job as a medical laboratory scientist is to make diagnosis, is to provide information that would guide in assisting patient management. We want to help those patients. This patient is not feeling well. Nobody comes to the hospital feeling well, except if you are trying to do medical screening or you are doing so. So a significant number, especially in our country where people still pay out of their pocket for healthcare. So nobody would have money. You will not have 20,000 on you, and you say the first thing you want to do, what you want to do with it, is to spend it on your health. Except you are very rich and you have health insurance that uh, has elements of treatment or screening, medical checkup. But when you don't have that, when you don't have luxury of resources, so you have to maximize the ones that you have. There are so many bills that are available for you that you have to deal with. So when you don't have that luxury of resources, the only time that most Nigerians go to the hospital or spend money on their health is when they have a particular disease condition. And that is the reason why histopathology is seen, many people talk about histopathology or diseases more than healthcare. Now, so when you patient, and what are the things that a patient would see? A patient will not see whether there is a problem with his or her tissue, whether there is a microscopic problem with his or her tissue. What the patient would first see is that the patient will not feel well. Everything is always, every disease starts with symptoms. So when symptoms are really, really present, for instance, there is a pain somewhere, something is swelling, something is wrong with the patient is not feeling fine. So those are the symptoms. And those are the symptoms that the patient will present to the hospital. And when they present with those symptoms, your job as a medical laboratory scientist is to strive to help them figure out what is wrong. Because it's only when you know what is wrong with the patient that you can now recommend the next line of action. For instance, if somebody is on fire, you cannot be giving that person paracetamol when he's on fire. You have to put out the fire first before you help the patient with whatever is still left. So, but without you knowing what is wrong with the patient, without you knowing that there is a fire, you may be applying the wrong thing. For instance, if you don't know that somebody is on fire, you may think petrol would help the patient. So you pour petrol on the patient, adding more salt to the injury, complicating the whole matter. So when you have this, when you have symptoms, your first role as a medical practitioner, as a medical laboratory scientist, is to know the underlying condition, what is responsible for this. And we do this in various components, in various elements, and to various extents in medical laboratory science, depending on the nature of sample that is sent to the laboratory. So if it's hematology, they send blood samples to them. If it's microbiology, they send microbiological samples to them. If it's clinical chemistry, they are analyzing the chemical component. While if it's histology, our focus in histology is on tissues. So we want to know what is wrong with the normal tissue before we can make our own diagnosis. So normal tissue of a kidney. Any questions so far? I want to so unmute yourself and ask whatever you would like to clarify on. So let me hear from you now while I look at what. So any question from me so far? Adesua. Adesua, I want to hear you.
No, sir. No, sir.
But are you following me so far?
Yes.
Okay. I think I should just share what I'm doing with you guys so you can follow me. What I'm trying to do is this. I'm trying to let you guys know that how things work. You know, when we, so histology of, so every tissue has its normal structure. Has its normal structure. So let's see how that comes. Now, what you're looking at is histology of the normal kidney. So everything looks like this when you're looking at a normal kidney. You can see the glomerulus, you can see everything. This is how a normal kidney histology looks like. So now when we want to look at abnormal histology, now I think this one has, so what I'm trying to drive at is that in histology or in histopathology, what we are trying to do is that we know what a normal tissue looks like. Now, such that, and so that when we now see an abnormal tissue, we can easily figure out, we should be able to know that there is a lot of difference. Now, I think I'm going somewhere with this. So I know these pictures are not really too perfect, but I want you guys to look up, compare what you're looking on your screen to what you're looking at here. So without being scientific, without being too specific, what are the obvious differences that you can see between this and this? So what differences can you see? Anybody? So what differences can you see between what you are looking at on the screen? Anybody? Adesua, what can you say?
The normal kidneys color is brighter.
Okay. So what of the abnormal kidney? Okay. I think that's a good try. Who else can I? Osunka. Sorry if I'm not getting your name right. Osunka, what difference can you see between these and this? Oh, Nene.
Okay, I'm not particularly sure, but if the glomerulus looks shrunken, a bit smaller, is that correct?
Okay, smaller, right?
Yes.
Then what about, look at the, okay, these are the, everybody just look at your screen. This is the, can you see my mouse? Nene, can you see my mouse?
Yes.
Now this is the glomerulus. And this is the glomerulus here. So what do you see? What is different? Like I said, no, like you said, it's smaller. Yeah, what about does this glomerulus look like this one?
No, it doesn't completely.
Yeah, that is the basis of histology. You have to know what a normal, once we see a picture of how that normal tissue is like in a normal patient, when you now see that tissue in a particular, in someone that is having disease, you can obviously say that even without doing any clinical chemistry, you can see right away that something is wrong with this glomerulus. That is what we do in histopathology. Now, if you also look at this, look at the entire slide. Look at this slide, this entire slide. Now compare here. That is why I really appreciate when somebody said mentioned the staining reaction. Now compare it about this. What do you think is different in this? What do you think is different, Simeon?
Sorry, I don't know.
No, I know. I'm not expecting you to be perfect. What can you see? Look at this entire slide without focusing on anything. Look at this entire slide. Look at this one, this A. What is different in the pattern? Okay, let's start with the comment.
I think this one is like, I think the glomerulus, the glomeruli, I think they are, I don't know, all those purple things, they are a lot inside. And
yeah, that's something.
No, they are not.
Okay, look at this now. Are you seeing this reddish stuff?
Yes, sir.
What is happening in the background? Is there noise where you are?
No, there's no noise.
Are you playing music? Something is, your background is not pure.
Oh, there's no noise, sir.
Oh, okay, sorry, I think it's feedback. I'm listening to myself. Now look at this area. You can see reddish stuff all over.
Yes, sir.
Can you see?
Yes, I can see.
Can you see them here?
No, I cannot.
So what do you think that represents?
I think those are like the diseased parts, like the disease.
It's spread everywhere.
Yeah.
So what you are looking at, those reddish stuff, that is hemorrhage, blood. So when you are seeing regions of, you are seeing blood cells over there, which means that patient, there is something that is wrong with that kidney that is making red blood cell that is leading to, that kidney is diseased. It has sustained injury. As you can see from this, we're already seeing abnormal glomerulus. We are seeing hemorrhage. So those are the ways we make interpretations and figure out what is wrong with the patient in histopathology. And so we have every tissue has its normal structure. For every tissue, there is a normal structure. And so when the patient now has a particular disease, you can now compare those, what you're expected to see in the normal tissue, like you're seeing in the kidney on your screen. But this is what you know that you're expected to see in an ideal tissue. But when you are not seeing that, and you are seeing this, obviously from your first view of that slide under the microscope, you can say right away that something is wrong with the patient. And so that is what we do in histology. And the entire scope of this course is to take you through how we prepare tissues, because for you to be able to get this slide from the patient, you have to cut a particular tissue. You have to collect specific specimens. And when you've collected that specific specimen, you are now going to process it and package it such that it become something that you can visualize under the microscope. And when you visualize something under the microscope, you should know what you're also looking for. So when you know what you're looking out for, is that time that you can now pull all the information that you've been able to get from the patient and from the sample macroscopy and microscopy together for you to now make significant conclusions. Most diseases have peculiar features in their tissue. For instance, if a patient has hepatitis in their liver or cirrhosis, the liver cirrhosis and hepatitis, they are different diseases, and which means they manifest differently in the tissues. So in the first case, you'll be able to see whether something is right or wrong with the tissue. And in the second instance, you'll also be able to know which kind of features perfectly aligns with a particular disease condition. And when you've been able to see, so in a particular, for you to be able to establish that this patient has renal damage. This patient has glomerulonephritis. This patient has cardiac failure. There are features that you are expected to see in that particular tissue that will make you reach that conclusion. So that is the essence of histopathology. Once we are preparing samples, we're analyzing samples and looking for these clues. Like we said, you look at whether there is hemorrhage. If hemorrhage is there, it simply means that there's something that is wrong with the epithelium of this kidney that is making blood components to be splashed all over the place. And he also mentioned that the way the cells are arranged, if cells are aggregating uniquely, that is also a particular message. Another thing that comes to mind is if the individual structures of individual cells. And this also becomes very much important when we are trying to make diagnoses for malignancy. These are the features that they look at under specimens that will make us to conclude whether a patient has cancer or not. So we are looking for clues. We are preparing samples for analysis such that we can get clues from them that will make us better understand the particular condition that a patient has. And everything we'll be talking about this course will be taking us from how do we prepare these samples, how do we collect these samples, how do we reach that particular condition that would make us to convincingly determine whether a patient has a particular disease or not. So that is a summary of what basic histopathology is. It cuts across, we go from the cellular, we are looking at the tissue level, cellular and tissue level, but we are coming from the sample methods, from the samples that we've collected. So which simply means if a patient has, if you are suspecting liver damage in a patient, you have to collect samples from, how do you collect that particular sample of interest? You have to collect that sample and you have to analyze the right sample. So what you have to figure out, what is the right sample that would make us reach that particular conclusion that this is right or this is what is happening, so that we can rule out our provisional diagnosis or not. So those are the issues that I think we have to look at. So we'll be looking at what we do, how the samples are collected, how we process the samples, because the way you handle the samples will also determine whether the information you are getting from the sample that you've collected will be reliable or not reliable. So even if you did not process the sample well, then some things can happen to that tissue that can now make you get wrong diagnosis. So samples have to be collected properly. They also have to be processed properly. And when they are properly processed and you are visualizing them under the microscope, you are rest assured that what you are seeing in the microscope is a true reflection of what is actually happening in the patient, and not something that is happening as a result of maybe an error in your sample handling technique. I hope that is clear to everybody. Who is Cruz? Cruz, what is your real name?
Hello, sir. Good morning, sir.
Good morning. You have to rename your profile so that we know who is. Because I'll be using this. I'll be using this to sort out the attendance. Okay, so please rename your profile. So did you get everything that I've said today?
Yes, sir.
So give me a brief summary of what we've gotten today so that we know what we are dealing with. Whether I need to still explain further.
Okay. So you told us the definition of histopathology, and that histopathology is divided into three phases. That's the histo, the patho, and the logy. And that the histo means tissues,
the patho means disease and the logy means study. So bringing them together means the study of the changes in tissue that's caused by disease or diseases. And then you told us that every tissue has its own like normal way that it is. That's like the histology of a kidney, that there's a normal histology of the kidney, and then there's an abnormal histology of the kidney. And then you showed us pictures of how a normal kidney looks like and what an abnormal kidney looks like. And then in the abnormal kidney, we could see hemorrhage, that's blood that's splashed all over the tissues. And then we saw the abnormal glomerulus. And then we saw that in the normal histology of the kidney, there was organized periphery of the cells, but in the abnormal histology, there was somehow accumulation of the cells or disarrangement, actually. And then you told us that the whole totality of histopathology is to know how the samples are collected, that the samples should be collected properly, and they should be processed properly too, in order not to make any mistakes due to that. That's what I got from there.
Clap for yourself. I think you got it up. Yeah, so I will give you guys an assignment to do against the next class, but we have to be seeing